My name is Elizabeth Kirsch, and today I will explain to you the advantage of occupational therapy for children in school. First, let's begin with what occupational therapy is as a whole. Occupational therapy helps individuals to participate in activities or occupations that are meaningful to them as independently as possible. For children, this is often focused on through play and school-focused tasks. Occupational therapists focus in school systems with developmental disabilities, with sensory integration, which is an issue that many children struggle with, and learning, including thinking, feeding, and doing. With this, occupational therapists view humans as active beings, have a value of the quality of life, and take a holistic and client-centered approach. It is important to remember that occupations are anything that one finds meaning in. This can include play, drawing, getting dressed, feeding oneself, playing a musical instrument, and much more. As children go to school, they engage in the occupation of education, which involves interacting with others, following rules, reading, writing, playground activities, and socialization. Occupational therapists help students to participate in these occupations as independently as possible. Frequently, adaptations are needed to allow all children to participate in these activities within the school. Occupational therapists help children in school who may have difficulty performing these tasks. Children may need assistance in learning how to work with their strengths and weaknesses. Occupational therapy provides an opportunity to empower children through play and successful experiences as well, and to lay the foundation for a strong sense of self and to lead a positive self-esteem and self-concept. Social participation is also an important occupation of childhood, particularly in the classroom setting. With social participation, students are able to get along with their peers, negotiate play issues, take turns, listen to their classmates, and express their needs. When issues with social participation arise, a team that consists of an occupational therapist, parents, and teacher can help play a positive role. Specifically in the school system, occupational therapists work with children to provide intervention to children with a diagnosis such as cerebral palsy, autism, Down syndrome, sensory integration issues, intellectual disabilities, developmental coordination disorder, and developmental delay. Additionally, some children experience childhood illness, physical disabilities, behavioral disorders, and psychological disorders that may impact their ability to function in school. With all of this, an occupational therapist can help increase their ability to function in school, succeed, and achieve high participation. The intervention for children in occupational therapy has a focus on play development. Through this intervention, children are able to learn cognitive, social, psychological, and language skills, which are all great skills for a student to be equipped with as a child and within the classroom setting. Though occupational therapy, children show improved motor skills, social skills, and cognitive skills. To allow school-age children to function in a school system, OT practitioners help children to obtain the necessary foundational skills for sitting at a desk, reading, writing, eating in the cafeteria, playing on the playground, participating in music, gym, and other academic learning activities to provide an advantage for the student to succeed and for the classroom to run smoothly. Occupational therapy within the school allows for children to participate in the classroom in the least restrictive environment, and this is key. The concept of a least restrictive environment is advantageous to the client because it is the classroom closest to a regular classroom in which the student can be successful. Occupational therapists that work with children are creative, playful, and help to promote structure and limits. Intervention is aimed at play to help children with school-age tasks and independence in playground behavior, handwriting, and learning self-care skills. This is advantageous for the child to build fundamental skills to succeed both in daily life skills in the classroom as well as for the teacher when teaching the class. OT practitioners consult with teachers to help benefit specific students and the entire classroom as well. For example, The occupational therapist can suggest ways that the teacher can promote handwriting in the classroom through warm-up exercises prior to the students engaging in writing. The OT would provide these exercises and consult and review them with the teacher. It is important to keep in mind, while occupational therapy is being provided in this instance, it is the teacher and not the occupational therapist providing the warm-up exercises or the intervention here. Occupational therapy for a child can be very beneficial in achieving developmental tasks and milestones. This can include behavior regulation, differentiating choices, increase in speed, accuracy, and coordination, learning how to get along with peers, developing skills for daily living, and developing skills in reading, writing, and calculating. It is important to keep in mind that occupational therapy services can be provided both inside and outside the school. When occupational therapy services are provided, a teacher will undergo an initial evaluation to assess where they are at. Sorry, I meant to say a child. A child will undergo an initial evaluation to assess where they are at. Following this, the occupational therapist, family, and possibly teacher will set goals for the child to work on during occupational therapy. Once occupational therapy services have been completed, a final evaluation will be held to assess if the goals have been met and if further treatment is necessary. I hope that this video helps you to understand why occupational therapy is so beneficial for the child. Thank you.